I'm very pleased to introduce Razaz, Shaheen, MPH, and Alaa, also with an MPH degree, preventive care students that are very dedicated students. So they gladly accepted to present about COVID-19 in LA County. So I welcome them, and I encourage them to continue doing what they're doing so good.
We will be presenting about COVID-19 in LA County, since both Razaz and I work for LA County. Okay, Los Angeles County Department of Public Health overview. Our mission, vision, and values. So the vision is healthy people in healthy communities, as I believe all the counties have the same mission, has the same vision. The mission is to advance the conditions that support optimal health and well-being for all. And the values for LA County Public Health Department is equity, inclusivity, collaboration, accountability, compassion, quality, innovation, and leadership. So a little bit of background on LA County. It's a big county, as we all know. It's 4,060 square miles, 88 incorporated cities, 130 unincorporated cities approximately, 2 islands, and over 10 million residents. This is a little bit extra part there. I believe Razaz will go over it later. So the service plan area, or SPA as a short, we have 8 areas in LA that we cover. As you see, we have them in different colors and numbers. So SPA 1 is Antelope Valley, SPA 2 is San Fernando, SPA 3 is San Gabriel, SPA 4 is Metro, SPA 5 West, SPA 6 is South, SPA 7 is East, and SPA 8 is South Bay, which is Catalina. We usually refer, when we are working or when we're emailing, we just refer to them as SPA 1, so everyone in the county knows which is SPA 1 and which is SPA 5, and so on and so forth. So LA's county population, and this is from 2016. We didn't get the latest one yet. From the age groups, we have the majority of the people or the population are between 25 to 44, which is 30%. 25% for 45 and 60 to 64, and then the minimum is 5 years and below, which is 6%. The racial composition, we have the majority Latino, which is 40%, then followed by white 22%, followed by others, which is 16%, Asian 12%, Black 7%, and 3% are mixed. How big is public health? We have more than 50 divisions and programs in the public health department. We have approximately 4,100 workforce, and the budget is $3,036,000 and $4,014. So a little bit of background about coronavirus. I'm pretty sure by now everyone knows about coronavirus in depth, but let's go over it. What are coronaviruses? It's actually named for the spikes on the cells. As we know, it's like a circle or with the little spikes on it, as you guys see in the picture. It causes a range of illnesses from a common cold to SARS. Rarely, these coronaviruses evolve from animals and infect humans, typically causing mild to moderate illness in people. So, formerly referred to as 2019 novel coronavirus or 2019 nCoV, as we refer to it in the county. COVID-19 is a disease. SARS-CoV-2 is the virus that is causing the disease. So basically, it depends on the email or depends on the work that you're doing. You either refer to it as COVID-19 or SARS-CoV-2 or 19 nCoV. SARS-CoV-2 related to bat coronavirus or bat CoV RATG13. It's likely emerged in November of 2019, not last year, the year before. Coronavirus has previously demonstrated a capacity for pandemic spread as SARS or MERS, as we all heard about. So novel viruses are of particular concern because of the lack of herd immunity. As we can see here in this picture, it shows that the purple people are not immunized, but still healthy. And then there are two people in the first line here. We can see like there are two people are not immunized or sick and contagious. So when there is no one is immunized and there are contagious, two or maybe even one contagious disease spread through the population, then we will have more sick people and carry the virus. And the same thing with the second row here, we have so many purple people which are healthy, not immunized but still healthy, with couple yellow people immunized and healthy, but there are two contagious people. That means the virus will spread again, even though they are all healthy, but they're not immunized. However, if we have the majority of the population are immunized and healthy, couple are contagious, couple are not immunized but still healthy, the virus will not spread as it was before, since everyone is immunized and healthy. So what is the mechanism of the transmission of this virus? This virus spreads mostly through large respiratory droplets. So when people sneeze without covering their mouth, or when they're coughing without covering their mouth, it doesn't travel far. It doesn't linger in air, but it's mostly travel between people who are in close contact. So this is a CDC update. Evidence showed airborne transmission of COVID-19 between a non-infected person and an infected person who are more than 6 feet apart only under the following conditions: enclosed space with poor ventilations. So the primary symptoms for COVID-19 are fever, cough, cold or flu-like symptoms, difficulty of breathing, sometimes shortness of breath, loss of taste and smell. But these are the main common symptoms so far. So what are the side effects of having the virus? One of the side effects is ARDS, or acute respiratory distress syndrome, which affect the lung and cause severe lung damage. Another one is MISC, or Multisystem Inflammatory Syndrome in children. The treatment, or at least there's no treatment yet, but at least we can say a way of prevent this virus is if you're having a mild symptoms, just isolate at home, rest, and drink a lot of fluids. If you have severe symptoms, you can maybe go to your doctor for more supportive care, drink a lot of fluids. Some severe symptoms needs to be having oxygen or ventilatory support at the hospital or ICU. So this map is for the cases, how they are spread, and this map is from 2020, October 2020. This is how it spreads in North America, South America, and all over the world. So to flatten the curve, this is the COVID-19 virus without protective measures, and this is with the protective measures number of cases. This is the number of cases with the protective measures. This is without protective measures, the red one, and this is for the time since it first started back last year. And this is basically the statistics or the tiers of the risk levels in LA County. Currently, we're in the orange, which is moderate. We are hoping by the end of June to be in the minimal, which is the yellow tier. But currently, we're here in moderate. October of last year, this is the map from October of last year. We were still in the purple tier because the vaccines weren't really distributed to everyone yet. Now it's Razaz, and she will go over some more.
Hello. So here we're gonna talk more about data. In my department, we work more about the vaccine distribution and CHW outreach initiative, which mean we work with the CHW community health worker, how they acknowledge the community about the vaccine and also about the virus. So weekly we do like either daily report or weekly report to Dr. Ferreira about what's going on in the community, about the vaccine distribution, and also about COVID cases among LA County. According to Dr. Ferreira, the director of Los Angeles Department of Public Health, due to the complexity associated with health equity, there is a need for multi-faceted approach to determine the possible solution to help improve the overall health among those in LA County. This is her statement, and that this is her goal, which is improve health equity among all LA County residents in LA County. Okay, here in this slide, COVID-19 vaccination in LA County until May 7th this year, 2021. As you see here, as of May 7th, Department of Public Health has demonstrated more than 8 million doses of vaccine in the county. Of these, over 5 million were first dose, and more than 3 million were second dose. This means over 5.1 million individuals have additional protection for COVID-19, and over 3.3 million are fully protected. Alaa, go to the next slide, please. Alaa. Yeah, here when I talked about the number in the first and the second dose. As we know, CDC, based on the CDC guidance now, not just 16 and above, even like 12 years old and above, they can get the vaccine. In LA County, people can, Alaa, please go back. People can, residents who live in LA County, they can contact either this number or they can go online to make an appointment for the vaccine. And a month ago or 2 months ago, they start accepting people who, just go to the side, like walk-in appointments. Next slide, please. Okay, as we see here in this table, over the last several weeks, we have seen a decline in the total number of the vaccine distributed throughout LA County. This issue is not unique in LA County. This issue, as we know, it's a trend we see occurring across the nation, and something we would like to learn more about it. And this is for the next 3 weeks. This is our goal in my department, is to figure out where's the gap, where's the issue, and also find more about places where people can get together, or the crowded area, to put more sites for people to get the vaccine, to have more sites on those areas for people to get the vaccine. In the last 2 weeks, we saw a 24% drop of the vaccination, which is not our goal. Our goal to help people to get the vaccine before the end of July or before the end of June, when we're gonna open everything with the full capacity. Alaa, next slide, please. Okay, as you see here, the percentage of race and ethnicity group 16 and above population who have received at least 1 dose of the vaccine. Only 38% Black or African American, 42% Latinos, 58% American Indian or Asian Native, 60% white, 68% Asian, 106% Native Hawaiian or Pacific Island. Next slide, please. Okay, in this slide, we see the percentage of LA County residents by age who have received at least 1 dose. As you see here, 65 to 79 years old and 8 and above, the number is the percentage is high, 86% and 73%, and that was our goal, to protect elderly and help them get the vaccine. That's why when we opened the sites in LA County in the beginning of January, we found out that a lot of elderly, they couldn't either call or go online, register, or create an account. So after when we found that a problem we have, I had the same question. Who's saying this in the center? Okay, so after when we figure out that elderly, they have a problem accessing the vaccine site, we opened the walk-in appointment. That's why the number increased among senior in LA County. And as you see, between 16 to 17 years old, 34%, 18 to 20 years old, 45%, and between 30 to 49 years old, 54%. Alaa, next slide, please. Here, proportion of LA County resident age 16 and above between genders: male 56%, female 62%, other unknown, very, very like low percentage. Alaa, next slide, please. Here in this slide, in this map, you can see the distribution for the vaccine. In the dark green area, this is where a lot of people got the vaccine. and 30, a lot of people got the vaccine. 39% of LA County residents are fully vaccinated. That was until last week. So for sure, this week we have more numbers, which is high percent. It could be like a little bit high. And 67% of residents, they are 65 years old and older, who live in LA County, and 33% of the resident in LA County between 16 years old and 64. But so far we have 39% of LA County residents who are fully vaccinated. Alaa, next slide, please. Alaa, the one before, please. Yes. So as you see here, first when we started with in LA County, they started with 3 sites of vaccine, one in Inglewood, one in downtown LA, and one in Dodgel Stadium. And now, as you see here in the map, they have a lot of vaccine sites. The open vaccine site in school, the open vaccine site in church, pharmacies, even in some park in LA County. Next slide, Alaa, please. And here, some of the sites that they opened in schools in LA County. They even have the open site in several or a couple of schools in LA County. Next slide, Alaa, please. So as I mentioned in the beginning, we work on 2 projects, vaccine distribution and CHW outreach initiative, which mean we have like a training program for the CHW, and in this training program, we educate or we help CHW learn or know how they can spread the word among the community. So for CHW, when they go and work on the side and talk or interact with the community, they always have to tell the people in the community about 2 or 3 important things. The 800 number, the Department of Public Health vaccine call center, and educate people how they can either go online to the website or call the number to make an appointment or find a local pharmacy, or just walk in. They can go and walk to any site in LA County and they get the vaccine right away. All what they need to be qualified or to get the vaccine, just identification, any kind of identification, either driver license, passport, any kind of identification that they have. We can put it in the system, and then we give them the vaccine to have like a document that they got the vaccine. Alaa, next slide, please. So as we mentioned before, who's qualified to eligibility criteria, senior for sure, they are eligible to get the vaccine. Before it was 16 and above, and 2 weeks ago they sent an email saying that according to CDC 12 years old and above, they can get the vaccine. all what they need to have, just a proof of like any identification to put their name in the system, and then to get the CDC card that this says, oh, they got the first or the second dose. We both, me and Alaa, sometimes we go to the site and we work on the site. We help nurses to give people the vaccine. So we work on those kind of things. We educate people, we give them information, we give them brochures, or we put their information in the system. So yeah, basically that's what we do in LA County, and this our goal. That what we are doing so far. We have almost, like, let's say 40% people in LA County who's fully vaccinated, and we are looking more. We are looking to vaccinate more people in LA County, and our goal is to at least have 60% of LA County who's fully vaccinated by the end of July. And yeah, here some tips how to stay safe, wash your hand, cover your face, like the social distance, and all those things. Any questions?
So these, just to add a little bit more, these are mostly the CDC guidelines that we've been following for a long time now. It's how to practice everyday preventive actions, like wash your hands, don't leave your house without a face covering that covers your nose and your mouth, because there's no point to cover your mouth without your nose. If you feel sick, call your healthcare provider, use hand sanitizer. Again, wash your hands before and after touching any of the surfaces. Physical distancing, 6 feet, keep your 6 feet apart. And then, as I mentioned, face covering, because as we mentioned at the beginning, it spreads through the droplets. And then just be aware of any false reports, because nowadays with the social media, everyone will post something. They're going to refer to it as something from the CDC or something from the public health department, but it might be fake. So if you want to get more information, just visit the actual website of the CDC and the public health department to get more information. Also be aware of any fake products. There is no treatment for COVID-19 as of now yet, other than the vaccines. But some people just use a couple pills or claim that it's effective to treat the virus. But if there's no information from the FDA, CDC, or WHO, that's going to be a false advertisement. Those are the websites or sources to get more information about COVID, or about the statistics, or about any COVID-related information. CDC, the Department of Public Health in LA County. And that's pretty much it for this presentation. Do you have any questions?
I see a question here in the chat regarding about the percentage. This percentage include even the Filipino population and other population too, other ethnicities too. That's why it's 106%. Is over, yeah, that's why it's overestimated.
It still seems it doesn't make sense, because if it includes alter groups, you have to increase the denominator to include these other racial groups. So it still doesn't make sense no matter how you couch it.
I'm saying that, Dr. Larry.
Because you have to have an adequate denominator of the different groups as the denominator, and then a subset proportion of those get their first shot. There's just absolutely no possible way to have more than 100%.
That would data monitor person who told us about the percentage, that they added different groups like a Filipinos population. That's why it's over 100. But yeah,
Well,
you're
that just
right.
means you have
Yeah.
people in the numerator that are not in the denominator, and that's an inappropriate percentage then. See, if you've only listed Native Hawaiian and Pacific Islanders, but if you start adding a bunch of other people being put in the numerator that are not in the denominator, then that's inadequate. That's an error. You can't have people in the numerator that are not in the denominator.
Razaz,
Mm-hmm.
looking at the numbers, would it be that it's 10.6%? Because that's roughly the, it's a minority population that is not comparable.
Then you got a decimal problem.
Yeah.
Yeah, it could be, and because they have like a specific, I think, variables, and they can't add more variables, or because and also they have like specific questionnaire for all those race or ethnicity. Maybe that's why they start adding more numbers to that, Native Hawaiian or Pacific Island. They include them under this category. I agree with you, but yeah, that what we got from them. But yeah, you are right, Dr. Larry.
Yeah.
I
have another question. Yeah, I have another question. On your comment about giving money to people, whether it's $75 or $1 million or whatever these people are doing, doesn't that actually teach people that when the next pandemic comes around, well, let's wait until they start offering money before I get my shot? So it seems like we're teaching people to just sit around, even though their vaccines are available. Let's say next year when there's another type of a Corona 21 vaccine around, and we say, okay, we hope everybody gets a vaccine, but if we wait long enough, maybe we can get some money. So it seems that's a counterproductive. What do you think about that?
Yeah, I agree with you, but there is a survey people they have to fill out. So a lot of, as we know, a lot of people sometimes they don't like to fill like a long survey, or don't have time to fill out a long survey. And we need this information. We need this document to help us identify or know where's the gap, or how to fix the problem that we have in the county. That's why Dr. Ferreira decided to let's do this. Let's give them like a giveaway or something, or like a gift card to help them collaborate with us.
I just think it just teaches me that I said, boy, I got my vaccine early. I should have waited, and then maybe I'll get $75 months later. So maybe it was my mistake to get a vaccine early.
Yeah. Also, and you are right. And unfortunately, before we start doing this, not a lot of people got the vaccine, and we saw a huge increased number after when we did that. But
I just wonder what we're teaching the people.
Yeah.
Well, I'm ready to move to LA to get that $75.
And now I think before they were kind of strict, but now anyone, people who live in any county, they can get the vaccine in LA County. So yeah, take advantage of it.
They're actually.
Yeah, I had a question on the map. Okay, Alaa, can you go to the go forward to the map where there was like the dark green and the light green, showing the vaccination. I think it was the vaccination.
The vaccination sites.
Yeah, the sites. Oh no, it's the map that had the green, the different shades of green.
The GIS map.
Alaa, GIS map.
Yeah. Oh yeah. Okay, that one. Yeah, the one that you just passed.
You had.
So
Yes,
what? I was just curious. What is that dark? Where exactly is that big dark green spot up in the northern part of LA County? Where
yeah.
is that?
This the dark green where we have a lot of percentage of people who got the vaccine in that area, who at least finished the first dose.
Yeah, where is that exactly? I'm not familiar with LA County.
Me either. I'm not that familiar with LA County, but I think it's up north. Yeah, here in
That one is Glendale.
Spa 2, Alaa.
So it's in two, huh? San Fernando.
Yeah.
Glendale and East Valley. It's between these two areas.
Okay. Oh, that's like near Simi Valley. Okay. All right. I was just curious what was special about that area that they had such a big dark green area. So
Maybe
okay.
north of Glendale.
North of Glendale, yeah. Okay, thanks.
What we found also, Dr. Medina, that some area they don't have a lot of site, and this is our focus now, to focus on those kind of area. Like now we have a lot of sites in downtown LA, because as you know, we have a lot of population of homeless people in downtown LA. That's our focus now, and in some areas where they have like poor area, we increased the number of sites on those areas.
Very good.
Also among the area where African American live, we increased a number of sites, because as I mentioned in one of the slides, we have only 38% of African American population who got the vaccine, which is, comparing to other race or ethnicity, it's low. That's why we increased the sites among those areas. Any other question?
Yeah. We heard about people not getting the vaccine because of the spread rumors and misconceptions. And so what is the county doing about that?
I never heard about that. When did you hear about that, Abel?
I've seen people not getting vaccinated. Actually, I was in one of the vaccination posts Tuesday, and in the LA produce market, there were hundreds of workers that didn't want to get the vaccine because they say the side effects are so bad that they prefer to stay away from the vaccine.
Yeah, I heard about something like that. And this is another thing that we focus on. We in my department, they do like a weekly sessions or meeting with CHW to get more information about what's going on in the county. And I agree with you about, a lot of people say we don't want to get the vaccine because of side effect, especially Johnson & Johnson. And now 2 weeks ago, LA County started giving Johnson & Johnson, and we saw a huge decrease of number, and not a lot of people, they want to get the vaccine. So I know I agree with you about what can we do. The only thing that we can do to educate people about the vaccine. Okay, there is side effect, but it's different from one to another. Like for me, I had a fever, and my roommate who lived with me, she had a totally different side effect. So it depends about it's different from one to another. What can I say? So we're trying to educate people. Okay, so there's a side effect, but not like what you think. It's not something like a minor, like a fever or something like that. But Johnson & Johnson, because we didn't have a lot of studies, we can't say anything about it. And like I walked on the side last week, and someone asked me about Johnson & Johnson. And to be honest, I didn't have a clear answer to him. So I called the nurse to come and help him. And even the nurse, she told him, you know what, if you wanna, like, she tried to explain to him, and then she told him, if you want to get the vaccine, go for it. But if you don't want, we can't force you to get the vaccine, basically.
I just want to add to that. So in each site or in each location for vaccines, we have nurses and doctors who can answer questions, and we usually get people come to the vaccine site with so many questions and concerns. Then they start asking those questions to the doctor. We don't force people to get the vaccine, but we explain to them everything. All the side effects, all the possibilities that might happen if they want to get the vaccine. It's all up to them after they talk to the doctor, after they talk to the nurse. Some people just go ahead and take it. Some people just leave the site without the vaccine. It depends on how they're taking the information that they asked the doctor about.
Adding to what Alaa said, also for now, because we start giving like 12 and above. So from 12 years old until I think 18, we have a consent form. So parents, they have to come with their kids to give them the vaccine. And the parent, they have to sign a consent form before we give them the vaccine. And in some cases, when we have when a person come with a lot of questions and start asking a lot of questions, the nurse put a note in his file or her file about the conversation and what happened in the conversation. One time we had a lady who's breastfeeding, and she had a lot of questions about the vaccine, and the nurse put all the you know what happened in the conversation, the whole thing in her file, just in case if anything happened in the future. So all what can we say is just, you know, educate people on you know, help them to understand what's, you know, going on among the community. Not maybe it's not true or not accurate information. So yeah, that's what we're trying to do. I know it's kind of hard. It's very, very hard. You know, first before I start going to the site, I thought, oh, okay. When we work with the CHW, we told them, okay, just say this and this and that, and help them to understand this. And you know, they told us it's not easy. And when I went to the site, I felt and I saw, you know, it's not easy to educate people and to help them, or you know, to convince them, or you know, about the vaccine, if you want to get the vaccine or not.
Just a comment, you mentioned about the 12 to 17 with the informed consent of the parent. On the news has been several where the teenagers really did want the vaccine, but the parents were reticent. So that was where there was a conflict within the family, that the parents still had this misinformation and in denial and had problems with it, even though the kids wanted it. So
Yeah.
there was a struggle.
Yeah, we have that problem even before COVID. You remember, like we struggled before, even with the school children. You remember, like when we have a problem about the immunizations. So we have that problem, and yeah, when sometimes when when I walked in on the site, I saw a lot of like kids. They came to the site to get the vaccine, but without their parents. We can't give them the vaccine. So that's why we have a consent form, and parents, they have to fill out the consent form and they have to sign the consent form. We tried, but we can't.
Okay, I think we are, if no more questions, we thank you for your presentation. It was very interesting for us to know what's going on there in Los Angeles.
Thank you, Razaz. Thank you, Alaa.
Thank you, Adele.
It was good.
Thank you, everyone.
Thank you.